We now have a quorum. Welcome to the Health Services Committee meeting. First order of business is to approve last month's committee meeting minutes. Motion made by Supervisor McDevitt, second by Supervisor Conover. All in favor? Opposed? Carried. We are going to switch it up and have Rob go first. Take it away.
Okay, thank you, Mr. Chairman. I have handed out agenda packets. They're on the table there if anyone doesn't have a copy. My first item is a request to change salaries. We have a mental health program analyst that I would like to change from $53,500 to $51,500, and a children and youth SPOA coordinator position that I would like to change from $53,500 to $55,500. My reasoning for that really is that we were able to hire the program analyst at a bachelor's level instead of a master's level, and we are currently recruiting for the children and youth SPOA coordinator, and I'd really like to bump that up so that we could recruit a master's level. It's budget neutral, and these are 100% state dollars that we would just be moving between the two positions.
Okay. Motion made by Supervisor McDevitt, second by Supervisor Conover. Any discussion?
One question, Paul. This is, you're good with this?
Yes.
Okay.
All in favor?
Aye.
Opposed? Carried.
Okay, second item is a request to appoint Amy Malloy, who's a Queensbury resident, to the Warren County Community Services Board. The term would be January 1, 2016 through December 31st, 2019, to fill a vacancy created by resignation of Michael Hominick.
Motion made by Supervisor McDevitt, seconded by Supervisor Conover. I actually know Amy, and she is a standout woman.
Oh yeah, she's fabulous. She's done a lot of work in the area of suicide prevention.
Yeah.
And we've worked with her on various projects, so we would be pleased to bring her on to
She's
the
very solid. Yep.
service
Good.
board.
Glad to hear that. All in favor?
Aye.
Opposed? Carried.
Okay, and the third item is a request to approve our new contracts and renewal of contracts with community agencies for 2016, local mental health, substance abuse, and developmental disability services. This is consistent with the amounts approved in the 2016 Warren County budget, and there's an attachment there that lists our contracts with our various community agencies. These are continuation of current program.
Okay. Motion made by Supervisor Conover, second by Supervisor McDevitt. Discussion? All in favor?
Aye.
Opposed? Carried. That's it, Rob?
That's all I had. Thank you.
Beautiful.
Thank you, Rob.
Okay, we have public health next. Pat, if you're ready, go right ahead.
Okay, first thing on our agenda for this morning is to request a resolution to authorize Janelle Jones to enroll in a graduate level course at SUNY Albany School of Public Health entitled Introduction to Environmental Health. At a cost to the county would be half of the course fee, plus course materials if needed. No work time would be needed. New York State Department of Health is deciding that they would like to encourage any local health department people, even though we're not full service and don't have jurisdiction, to learn more about environmental things involved in preventing and controlling communicable disease. So we're lucky she's going to volunteer to do that.
Conover, second by Supervisor McDevitt. All in favor?
Aye.
Opposed? Carried.
Okay, the next thing is Ton requests for budget transfer funds and budget amendment.
Attachment number 5 are transfer of funds. The first one is for $1,889.62. We basically, one of the employees in WIC just took on the health insurance effective November 1st. So we needed to move some money to cover that till the end of this year. And our second item is moving some money from our disease program into our CHA. We've done a lot of moving down there in both public health and our CHA sides, and we have some work we want to get done and get organized, and so we're moving $2,000 there to help cover those costs for the year. Those are the only three.
Motion made by Supervisor Conover, second by Supervisor McDevitt. All in favor?
Aye.
Opposed? Carried.
And then attachment number 6 is just a budget amendment. Our lead program, we were notified of COLA for $1,757, so it's amending the budget. all of the COLAs, even though they go to March of 2016, they really want me to submit them all by the end of this year. So we're amending the budget in 2015 so we can get that out and get that money in.
By Supervisor Conover, second by Supervisor McDevitt. All in favor?
Aye.
Opposed? Carried.
We have no pending items for this month. Moving on for information for discussion and review, attached to number 1 is our monthly emergency response and preparedness report. Everybody got that, I believe. If anybody has any questions? Otherwise, we can move on to the status of referrals. Sharon, do you have comment on?
Our numbers are identical to what they were last year through this time.
That's good.
We're doing very, very well. Proud to say.
I'm not surprised.
As long as we can keep staff to see the people, we're good. Moving on to reports of expenditures and revenues. John?
Attachment number 2, our financial report as of November 29th. Status quo, we're still, again, it's not the end of the year, and our preschool program, which I always say is, we can't bill until about March of next year, which will go from July till December. So when you compare it to next year, but those numbers will all catch up by the end of the year once we do our final bookings. Regarding salaries, when you're comparing our salaries again, our regular salaries are down by over $36,000. Our overtime is down year to date compared to last year by $3,200, and our part-time salaries are up $26,000. But the net effect is we are under last year's budget by over $13,000. And again, that's due to our nursing position shortages. We thank God got a good per diem part-time group of nurses that are helping out there, and that's helping keep both the regular salaries and overtime at this point down. But again, looks like part-time is up, but it's really working for us. On the attachment number 3, which is comparing last year to this year, one thing I did do is last year we had our meeting on November 25th, and it was a general ledger as of the 19th, so really there were 10 days off, and it really wouldn't be an accurate comparison. So what I did is go out and get information as of November 29th of 2014, and loaded those numbers in because it included a payroll, which can really make a big difference. You'll see overall our expenses are down compared to last year by over $104,000. Our revenues are down slightly, but again, it's due to timing of billing with our preschool and our EI. Again, a lot of those we haven't done. And we were just saying that our long-term care program, as you are aware, is being reduced, but a lot of those people might be transitioning to the CHA. So we like to look really at it as a whole, the CHA and the long-term together now, even though they're separate on the general ledger, but we do try to keep those together because they really work well together. But overall, as of November 29th, this is where we stand with comparison to last year.
I love the Conover report, don't we?
Yeah.
Go ahead.
Yeah, so you have a few $1 million in trailing anticipated expenditures that will be between now and the end of the year.
I mean, payroll alone will be a big chunk of that,
Sure.
really, when it comes, because we will have that for December. This goes right up to the end of November, so everything's been posted there. But regarding that, will we meet the total expenses? Maybe not, just like last year, but I do say if our expenses we don't meet, our revenues will be reflective of that too.
Very good. These are excellent reports, as usual. Thank you.
Okay, moving on to our, don't want to call it the problem of the day, but it's a little bit of a problem for us. We've been experiencing a number of issues with our 2013 Fiesta cars, of which we currently have 10 in our fleet. We did have a meeting with the county administrator and county administrator's assistant, and Julie Pacina, the purchasing person, Diane DeCesar, who takes care of managing the fleet in our office, and Ton and Sharon didn't go, Ton and I were there.
And Dan.
I contributed, but I didn't attend the meeting.
And Dan from DPW.
And Dan Smith, the shop supervisor from DPW, just to discuss what the issues are. And we did give them all of the issues that we've had. These particular vehicles have had 2 recalls. We've had them in to have the recalls fixed. The nurses are complaining that they don't feel safe in the vehicles, that they're they can't depend on. They don't go up hills, they don't,
There's a hesitation with them when you drive them. Like if you're at a complete stop, if you're doing long distance driving, because I took them out and drove, and I've been driving since probably I was 13, so.
Are they not winding them up
Everybody that-
properly?
Pardon?
Are they not winding them up properly?
When you stop, come to a stop and you go to pull out, there's a hesitation with it, and I got caught with one just a couple days ago. And at first, as I'm doing long distance driving, whether I'm on the Northway or driving, up Route 9 where it's extended, they're okay, there's no hesitation. But when you come to a stop and go to pull out, when you think you're gonna be able to go, there's a hesitation, and I almost got, bumped in the back end. So that's what they're feeling unsafe about, actually. So.
we did make a plan at the meeting that, the shop supervisor is gonna ride with the nurses. Apparently with these new kind of cars, there's some kind of a way that if you drive them in a certain way. Anyway, he agrees that there's a problem with it, but, he wants to go through each and every car with them, and then we'll have another report, and if necessary, we might be looking to, have the county attorney research the lemon law, because they're low mileage cars. But we have to be concerned about the safety of the nurses as well. And I don't know, Paul, do you have any?
Yeah, I think that, just so the committee knows, is that, we called this meeting together because here again, we take, these type of matters seriously. The, safety of our employees is paramount. We did come up with a multi-pronged plan, which is why I had everybody at the meeting that I had there. The county will no longer purchase these type of cars going forward, so that we avoid, obviously, having these issues. We don't know, and I don't wanna disparage the car, because we don't know enough about the situation at this point, but they're small anyway, and so we're looking at going up to a little bit bigger car, because that's been one of the complaints. So we go up to, I think they're subcompacts, we're gonna go up to compacts. So that's one prong of the approach. As was mentioned, our auto mechanic, Dan Smith, in fact, he should have started this past Monday, was gonna test drive each one, document it, and if there is a problem and the company won't fix it, then obviously we're gonna go to Martin, as to whether or not there's any legal recourse, have him research that out. The other aspect of it is to, if the cars are, sometimes it depends on what you're using the cars for, and if there's a way to shift cars around, for people who don't have the same needs, that it wouldn't cause them the same type of problems, we're looking at that as well. So we're looking at a number of steps to make sure we address the problem. We don't want anybody driving an unsafe car, so that's not an option, but, it's a process that we need to get through, and I think the first and most important step was, okay, let's stop buying more, right? And then the second step was, okay, if we have problems, let's get them fixed, let's pursue legal remedies if we can, and then ultimately, one of the options that is on the table, but it's too early to say whether or not we would do this, and that is whether or not it would be advisable simply to trade them in. So that's on the table too, just so you know. So we looked at every possible thing, and I'll give the group credit because we all sat there and brainstormed about what is the best way to handle this. And then ultimately too, the other thing we did was make sure that the messages are getting back to the nurses that we are concerned, about them, and that we are addressing this problem.
And I did do that with the nursing staff, and I have to say that, they're appreciative that we're making steps to try to correct the problem.
Supervisor Brock?
I'm curious, how many miles are around them on average?
Well, I'd have to check with our written report, but I wanna say around maybe, if they're 15-ish maybe, and that might be high, 10,000-15,000. Yeah, well, actually, there's been problems with them for quite some time, and we've tried to address it, it just doesn't.
They've gone back like 3 times for the same recall, and when they come back, it doesn't seem like it's fixed it. I mean, she's got paperwork like this thick of just the recalls, and then that takes time, because we have to get someone to drive it to the dealership, and then coordinate with the nurse to get another car, and,
There's also been a recall, let the windows go down and up and down intermittently. you know,
Oh,
it's
what,
just kind of
automatically?
automatically,
There's
so
a particular
this time of year, that
dealership
could be a
that-
little problem.
There's a particular dealership that is, advertising, I'm sure you've all seen it, where you can get a bicycle, a TV, and a whatever. Those are the cars he's selling.
So what kind of cars are these again?
Ford Fiestas.
Ford Fiestas.
These are 2013s, and we didn't get any recalls on our 2014 yet. Mr. Smith looked it up, and he emailed us that there is recalls now on 2014. We haven't received any notices yet. But we haven't had any complaints with the 14s yet either. It's just been the 13s right now.
No, they're minimal miles on them.
I guess on a positive note, I have heard some nice comments about the new logo. Everybody's loving it.
Oh, good, good.
It's nice and bright and white, and I like it.
No,
Good.
noticeable.
Good.
So next month, there'll be more to follow on this issue.
Look forward to it.
Hopefully it's gonna be fixed. That's all we have. If anybody has any questions.
Any questions or comments? Motion to adjourn. Motion made by Supervisor
Happy
McDevitt,
holidays.
second by Supervisor Conover. All in favor? Opposed? Thank you. Thank you, ladies.